Today we are discussing about onychogryphosis or ram's horn nails. Onychogryphosis is a nail disorder characterized by excessive thickening, curvature and hardening of the nails, causing them to resemble a ram's horn or claw. It most commonly affects the toenails, especially the big toe. Key features: nail become thickened, yellowish or brownish. Nail curve abnormally and may be spiral or twist. Often painful due to pressure and deformed nail. Nail plate may be separated partially from the nail bed. Can lead to difficulty in your walking wearing chappals. Causes: trauma or repeated injury to the nail, poor foot hygiene or neglected nails, peripheral vascular disease or poor circulation, fungal infections like onychomycosis, psoriasis or the skin disorders, aging. Due to aging, nails may grow slower and thicker, genetic predisposition or congenital factors, systemic illness like diabetes, and symptoms: thick, curved and discolored nails, pain or discomfort when walking or wearing shoes, possible secondary infections under or around the nail, difficulty in trimming or maintaining nails. The best homeopathic medicines are: Silesia helps soften and strengthen thick, hard, deformed nails, and useful in slow growing nails with a tendency to thicken or crack. Support expulsion of foreign bodies from the infection. Graphitis indicated for the thickened, hard and brittle nails with the ridges. Useful when nails are yellowish, cracked or deformed. Help with skin and nail disorders prone to scaling and thickening. Thuja occidentalis. Helpful for nail deformities caused by fungal infections or warts. Supports healthy nail growth and reduces thickening. Often used when the nails are thick, brittle and crumbling. Antimonium crudum for nails are thickened, brittle and dirty looking. Useful in cases with skin eruptions and infections. Helps to reduce keratin buildup. Hepa sulfcalcareum, useful in chronic infections causing nail thickening and sensitivity. Helps with painful, inflamed nails and surrounding tissues. Calcarea car for thick, hard nails with slow growth, especially in people who feel chilly or sluggish. Helps to improve metabolism and tissue health. Calcarea fluor helps to hard, thick and curved nails. Support elasticity of connective tissues. Useful in nail deformities with the hardness and brittleness. Medorinum indicated in cases with the thickened nails following chronic infections or skin diseases. Useful for people with a history of gonorrhea or other long-lasting infections. Arsenicum album for nails thickened with the infections, especially if accompanied by burning, restlessness and weakness. Supports detoxification and tissue repair. And consider consulting a podiatrist for nail care in severe cases. Sulfur for chronic skin and nail conditions causing thickened, brittle and discolored nails. Helpful in cases with itching, burning and tendency to infections. Causticum indicated for hard, thick and deformed nails with a splitting. Helps with the toughening and restoring the nail integrity. Additional tips are: maintain the proper foot hygiene and keep the nails trimmed regularly. Wear comfortable and well-fitting shoes to avoid trauma. Avoid excessive moisture and fungal infections. Regular foot bath with warm water and mild antiseptic solutions. Moisturize the nails and surrounding skin to prevent cracking. Avoid tight footwear that causes trauma to nails. Trim nails carefully or seek professional help for thick nails. Maintain good nutrition rich in protein, zinc and vitamin A, C, E and biotin. The next topic that we are dealing with is onychorrhexis. Onychorrhexis refers to brittle nails characterized by the longitudinal splitting or ridging. The nails become dry, fragile and tend to split or break easily along their length. Key features are: Nail shows longitudinal cracks or splits. Nails are brittle, dry and rough. Splitting may extend from the free edge towards the nail root, sometimes associated with the ridging or peeling of the nail surface. Causes: aging, natural thinning and drying of nails, repeated exposure to water, detergents or chemicals. Nutritional deficiencies, especially biotin, iron and vitamins. Thyroid disorders or other systemic illness, skin conditions like psoriasis or eczema. Trauma or frequent manicuring. Fungal infections. Symptoms: nail that split lengthwise, brittle and rough nail surface, dryness and sometimes discoloration, discomfort or pain if splitting is severe. Silesia. The major drugs are silesia, one of the best homeopathic remedy for brittle, dry and splitting nails. Helps to strengthen the weak nails and promote the healthy nail growth. Useful in people who tend to be chilly and prone to infections. Graphitis, for nails that are brittle, cracked and dry with the rough edges. Helps in cases associated with the skin conditions like eczema or psoriasis. And phosphorus, for brittle nails with the white spots or longitudinal splitting, and useful in people with a tendency to bleed easily or who have weak nails after the illness. Medicines: Calcarea fluid helps for strengthening brittle, hard and ridged nails, useful when nails have fissures or splits. Natramur, for nails with dryness and splitting, helpful the brittle nails occur with the dehydration or stress. And Calica, for nails that split vertically and brittle, helps in cases with the associated back pain or weakness. Additional tips: avoid excessive exposure to water and harsh detergents. Keep nails moisturized with the natural oils like almond or coconut oil. Maintain a diet rich in biotin, zinc and vitamin A, C and E. Protect the nails from trauma and avoid excessive manicuring. Other topic that we are dealing with today is onycholysis. Onycholysis is a condition where the nail plate separates from the nail bed, starting at the tip and progressing the backward. They create a gap of space under the nail. Key features: the partial or complete detachment of the nail from the nail bed. The separated area appear in white, yellow or greenish. Nails may become thickened or distorted, sometimes accompanied by discomfort or secondary infections, usually painless unless complicated by infection. Causes: trauma or injury to the nail, fungal infection like onychomycosis, and psoriasis or eczema involving the nails, allergic reaction to the nail or allergic reaction to nail cosmetics or chemicals. Hyperthyroidism, certain medication, systemic illness, prolonged exposure to moisture. Symptoms which are include visible detachment of the nail from the nail bed, discoloration and under the nails, thickening or clumping of the nails, and possible pain if infection occurs. The major homeopathy drugs: graphitis helps with the nail separation accompanied by the thickened, cracked or rough nails. Useful when onycholysis is associated with skin condition like eczema or psoriasis. Nails may be discolored, yellowish or greenish. Silesia supported healthy nail growth and helps in nail attachment to the nail bed. Useful in weak, brittle nails prone to infections. Good for people with a slow healing wounds. Hepasulf-calcarea indicated when there is a pain, inflammation or infection around the nail. Help with the nail bed infections and promote healing. Thuja occidentalis, useful in nail deformities and fungal infections causing separation. Supports nail degeneration and reduce thickening. Arsenicum album, for infected or inflamed nails with the burning pain. Helpful in toxic states or if onycholysis is related to poisoning. Calcarea carp, for slow growing, thickened or deformed nails that separate, often indicated in people who are chilly, overweight and fatigued. Other medicine is Merck salt, for nails with pus formation, inflammation and foul smell. Useful when there is a tenderness in the infection around the nails and help in healing ulcers and preventing worsening. And calibromatum, helpful in fungal nail infection causing separation and good for thickened, discolored and nail onycholosis. And natremure for the nails separating after injury or due to dehydration, useful when onycholosis occurs with the dryness and skin peeling. Medorinum, indicated in cases with a history of chronic infections or gonorrheal toxins, useful for the recurrent nail infections and deformities. Carcinosinum, for chronic deep-seated nail problems with poor healing, often give when other remedies fail or in long-term cases also. General tips: keep nails dry and clean, avoid trauma or harsh chemicals on nails, treat any underlying infections or skin diseases, wear comfortable footwear to prevent nail trauma, maintain good nutrition for nail health. Next topic that we are dealing with is pincer nails. Pincer nails, also called trumpet nails or omega nails, are conditions where the sides of the nail curves inward excessively, pinching the nail bed and sometimes causing pain and discomfort. The nail may be U, V or even omega shape. Key features: nail edges curve sharply inwards towards the nail bed. Can affect the one or multiple nails, usually toenails. May cause pain, inflammation or pressure on surrounding skin. Nail plate thickness and compresses to the soft tissue beneath and often leads to difficulty in wearing shoes or walking. Causes: genetic predisposition, ill-fitting footwear causing pressure, repeated trauma or nail injury, aging, nail plate changes can occur due to aging, underlying systemic diseases like arthritis, onychomycosis or fungal infections, lesions or nail bed abnormalities. Symptoms: visible inward curling of the nail edges, pain or tenderness around the nail, inflammation or infection at the nail folds and thickened or distorted nail plate. Medicines are silicea, help for soften thick, hard and curved nails and support healthy nail growth and promote the correction of the deformities, and useful in slow growing and brittle nails. And graphitis, for thickened curved nails with a rough edge, helps when they are discolored or prone to cracking. Often used in skin and nail conditions with the hardness and deformities. Thuja occidentalis, useful for nail deformities linked to fungal infections or trauma, helps to reduce thickening and promote healthy nail regrowth. Antimonium crudum, helps in cases with thick hard nails and associated with issues, and useful if there is crusting or infection around the nails. Causticum, indicated when nails are hard, thickened and curling inwards, helps in restoring nail integrity and flexibility. Carbovich, for nails with excessive curvature and brittleness, helps to improve the circulation and nail bed health. Calcarea fluor, helps to increase elasticity of nails and surrounding tissues. Useful for nails are thick, hard, thickened and excessively curved. Supports correction of deformities by strengthening the connective tissues. Hepasulfcalcareum, indicated if there is pain, sensitivity or infection around the nails, helps with inflammation and promotes healing in infected or inflamed nail folds. Medorinum, for chronic nail deformities with a history of recurrent infections. Useful if there is a tendency for nails disease and linked to toxins or chronic infections. Merxol, helps in cases with inflamed, painful nails that may ooze or have foul odor. Useful when pincer nails are complicated by infection. Calisulf, for thickened, yellowish and hard nails with a tendency to curl, and helps with the tissue repair and reducing the nail deformities. The next topic that we are dealing with today is habitic deformity. Habitic deformity is a nail condition caused by repetitive trauma or habitual picking, rubbing or pressing of the proximal nail fold or the nail matrix. The part of the nail bed and which produce the nail is called the nail matrix, and this leads to a characteristic pattern of nail changes, and the key features are horizontal or transverse ridges and grooves on the nail plate, and the central depression of multiple parallel lines on the nail surface, and often describes a railroad track appearance, and often affect the one or both thumbnails, and nails may become rough, thin, and mishappen, and usually painless but cosmetically distressing. And causes are repetitive trauma from habitual picking, rubbing, or pressing of the nail fold, and nervous habits such as anxiety, stress, or obsessive compulsive tendencies. Sometimes seen in children and young adults with the nail biting or skin picking habits. Symptoms which are include the visible horizontal ridges or lines on the nails, and nail surface appears rough and scarred. Scarred. No infection unless the secondary trauma occurs, and nail growth may be irregular. And the major homeopathic medicines are following. Causticum helps in cases with the nail ridging and deformities due to habitual trauma, and useful for people who have a nervous habit of picking or rubbing the nails, support the tissue healing and strengthen the nails. And medorinum indicated in nervous or anxious individuals with a repetitive nail trauma, helps to reduce compulsive habits and promote the nail recovery. Nux vomica for the people with stress related habits, irritability, and nail picking. Useful to calm nervousness and reduce the repetitive trauma. Ignatia amara helps with the nervous tension, grief, or emotional stress leading to the nail picking. Useful for the irregular nail growth and surface ridges. And Silesia supports the healing or damaged nails and helps brittle, weak nails and improve the nail strength. Useful for the slow growing or damaged nails from the trauma, and the great for weak, brittle nails and slow healing of the nail trauma. Also help in individuals who are sensitive and easily stressed. Pulsatilla for individuals who pick nails due to emotionally insecurity or mood swings. Helps with the nail regrowth and reducing anxiety driven habits. Stephysagria excellent for nail damage caused by irritation or trauma, especially in people with suppressed anger or emotional stress, and helps to heal small wounds and supports the nail bed recovery. Calcarea carp for nervous, anxious people prone to compulsive habits, supports the strengthening or brittleness of nails and improve the overall health. And chamomilla for the irritability, restlessness, and nervous habits like nail biting or picking, especially in children, and help to soothe the nervous tension contributing to the habit. And phosphorus for individuals who pick nails due to anxiety or fear, and help to regenerate the damaged nail tissue to improve the nail health. And stramonium useful if nail picking is related to fear, nightmares, or traumatic experiences, and helps to calm nervous agitation. And the additional suggestion for the habitic deformity is try to consciously avoid the nail picking or rubbing, and use stress management techniques like meditation, deep breathing, and mindfulness. Keep nails trim, short, and clean, and use bitter tasting nail coatings or protective bandages if needed. And maintain good nutrition to support the nail health. Thank you.